the City of Detroit. I'm also the section manager for the Michigan Department of Community Health, Health Disparities Reduction, and Minority Health section. And while I am not in formal capacity here today, as a state of Michigan employee, I will say that in the work that we do, we look at and spend a lot of time looking at health-related data and other data that we have come to realize over time all relate to health. Things like access to transportation, access to quality education, access to healthy, affordable food, exposure to poor air quality. All of these things have their resulting effect in the decreased and worsened health status for African Americans and people of low income. But also, prior to my work with the state of Michigan, I worked with the University of Michigan on a research project called Healthy Environments Partnership. And our role there was to look at the so-called social determinants and neighborhood factors and how they influence risk in 3 Detroit communities for poor health status. Those communities were the east side of Detroit, southwest Detroit, and the Brighton area. I want to bring your attention to one particular aspect of the study where we looked at what happened during 9/11 when the trucks that were to go over the Ambassador Bridge were stopped in their tracks and set idle for days. It just so happened that our research project, we were monitoring blood pressure and other health factors for people living in southwest Detroit. And what we found was a change in blood pressure during the time that people were exposed to the diesel in the air, and an increase in hospital incidents in terms of people going to the hospital for either asthma or other kinds of cardiovascular related illnesses. And what that said to us was that this exposure over time does have an impact. And if anyone looks at the air quality statistics, we know that in Detroit, and particularly in Southwest and also the East Side, we're always at levels that are higher than the EPA recommended. So there is a lot of merit to this, and it's very important that we take this issue seriously. Lastly, as a resident of Detroit, I was raised in a neighborhood where there was exposure to airborne metals from several factories in my neighborhood. It was discovered and then silenced for many years. And while I'm not at liberty to talk about a lawsuit, I will say that it was determined that people in my neighborhood had been adversely affected, all African American, all working class, and this holds true across this country and across this city and across this state. If you are poor, if you're a person of color, the chances of you being exposed to airborne particulate matter, to poor air quality of other kinds is extremely increased. And so I think it's really important that we work very hard to make an impact to address this issue. Thank you.